Hi, I am Dr. Sidharth Verma. I am a spine and pain physician, and I treat patients who are suffering from chronic pain because of orthopedic, neurological, and oncological conditions. And I treat them using the MIPSI procedures, which is the minimally invasive pain and spine interventions without any open surgery, so that they can get back to work immediately and for a long duration of time. So for cooled radiofrequency ablation, we recommend those patients who are suffering from chronic pain, and this can be chronic back pain, chronic knee pain, chronic shoulder pain, and these patients can also have chronic neck pain. All these patients have tried various types of medications or other treatments like physiotherapy, complementary medicine, and even some injections. And these treatments have failed to provide adequate relief for these patients. In addition, we also recommend this to the patients whom we know that these techniques are not going to work, these traditional methods, and we tell these patients in advance, and they can benefit if they select this therapy very much initially. The major indications for cooled radiofrequency ablation include spine pain due to the facet joint pain syndrome, for which we do the medial branch block cooled radiofrequency ablation. Then knee pain, for which we do the genicular nerve cooled radiofrequency ablation. And in addition, shoulder pain, for which we denervate the articular branches of the shoulder joint. So cooled radiofrequency gives me a bridging option between the traditional medical management or management with basic pain procedures and the surgery. So for example, a patient comes to us who has been recommended surgery and they do not want to undergo this surgery, or these patients are in a very advanced stage of arthritis where they are not fit for the surgery right now. So these patients have no choice but to undergo cooled radiofrequency ablation. And the second subset of patients is the patients who are about to deteriorate, and we can prevent them from deterioration by breaking their pain cycle and give them relief so that they can do a very good rehabilitation and a very quick recovery. I still remember a patient who could barely get up, and she used to stay alone with her husband, and both of them were around 60 years of age, and her aim in life was independence. So she could not get up from the bed, and after this procedure she could get up, make tea for herself and her husband, and take the food which was prepared, or even prepare small amounts of food for her own self, and she became independent. Another patient who could not walk for a long period of time, and they could not be mobile and move independently. Now, after this procedure, I was surprised that they could go to the market, buy vegetables and come back, and this was one of the most starking example of how this procedure can change their lives. So this cooled radiofrequency ablation is a very well-defined procedure with definite indications and definite results. So this gives us a very good predictability in the outcomes, which can be game changer when the patients choose to opt for this procedure. And this factor alone is responsible for the great satisfaction which we get among the healthcare providers who either perform this procedure, as well as the patients who are going to have this procedure done on them. Healthcare providers, when they provide this as an option to their patients, they should know that this procedure has certain indications and this procedure has certain benefits, and if not done in a properly indicated patient, these benefits will not be achieved. Second thing which they should know is the proper technique, that how they should be able to perform this procedure, and if it is not performed properly, it can result in failure, and this will be bad both for the patient as well as for the healthcare system.